Hello students. So now coming to the sacrum. Now here you can see that this specimen consists of the five sacral vertebrae S1, 2, 3, 4, 5 plus it consists of the coccygeal vertebrae also fused together. Right? So what is sacrum? Sacrum stands for the sacred in Greek, and this is actually a triangular bone consisting of the fused five sacral vertebrae. Right. Now, what is the shape of this bone? It is triangular, so it consists of a base, two borders, and it has an apex. And it has a pelvic surface which forms the posterior superior wall of the true pelvic cavity. And then there is the dorsal surface which faces backwards and upwards. In the anatomical position, the sacrum lies at the upper surface of the body of the S1 vertebra. It does not lie in the horizontal plane, but it lies at 30 degrees to the horizontal, so that its pelvic surface faces forwards and downwards, whereas its dorsal surface faces backwards and upwards. Right now, so what are the parts of the sacral vertebrae? This we all know is the body. Then we have talked about the pedicles, which are very short. In these, we have talked about the superior articular processes. We have talked about the spine. We have talked about the laminae also. What about the costal elements? These one, the anterior ones, and the transverse processes. They, of all the sacral vertebrae, the bodies are also fused, but the transverse process and the costal elements are also fused to form the structure called as the lateral mass of the sacrum. And in between this median part formed by fusion of the bodies and this lateral mass, there are these foramina. On the pelvic surface are the four pelvic sacral foramina on each side, and on the dorsal side we have four dorsal sacral foramina on each side. Right, now coming to the description of the base first. So the base consists of, we know, the body first of all, and these wide wing like or fan like structures, these are called as the ala. Ala is the singular, ali is the plural. This is again formed by transverse process posteriorly and the costal element anteriorly, right? Okay, so the medial part of the ala is comparatively smooth and it is related to four structures that we will talk about later, and the lateral part of the ala is rough and it gives attachment to certain muscle and ligaments, right? So that is the base. Now the base is broader in case of females and shorter in case of males. In case of males, the width of the body of the first piece of the sacral vertebra, this one is greater than the width of the ala on either side, whereas in females this width of the body is equal to the width of the ala. Right, then we come to the description of the pelvic surface. The pelvic surface, we know it is comparatively smooth as compared to the dorsal surface, which is irregular, and the pelvic surface we all know faces forwards and downwards in the anatomical position, and it bears these transverse ridges. This one has been artificially produced. I think it was cut with a saw for some reason, but otherwise there here also is a transverse ridge. These transverse ridges, they depict the line of fusion where the intervertebral disc was present earlier, but the fusion has occurred now. So these are the bodies of S1, S2, S3, S4, S5. Then at the lateral ends of these transverse ridges are present these pelvic sacral foramina, right? Then these bars of bones in between these pelvic sacral foramina, these represent the costal elements, and lateral to these pelvic sacral foramina, the costal elements are fused with each other as well as fused with the transverse processes to form this lateral mass, right? Okay. And at the towards the inferior part, you will see that this lateral border turns medially very sharply. This is called as the inferior lateral angle of the sacrum. Then coming to the dorsal surface, now we can see that the dorsal surface is comparatively irregular and it is convex in shape and faces backwards and upwards. Now here we have three crests, formation of three crests. Which are these crests? One is the median sacral crest, which is formed by the spinous processes, right? Of the S1, S2, S3. Sometimes there may be four tubercles, sometimes there may be three, but the fifth tubercle is absent because of failure of fusion of which structures of the sacrum? These structures would be what? You can guess. Yes, these are the laminae. So the laminae are fused with each other. The laminae of the two sides, which are normally fused also, but the laminae of upper and lower sacral vertebrae are also fused with each other. So this position would have otherwise been occupied by the ligamenta flava. But here it is totally ossified and the place is totally closed, right? So but the laminae of the fifth sacral vertebra are not fused with each other, leading to formation of this gap which is called as the sacral hiatus. And here this you can see is the coccygeal vertebrae. Okay, so this was the median sacral crest. Then we lateral to it, by because of here you can see these are the superior articular processes and the superior articular facets facing backwards and medially. Okay, chiefly backwards and slightly medially also. And we can see that in line with the superior articular processes we have these inferior articular process of S1 and superior articular process of S2 and so on. So these are the articular tubercles forming the medial sacral crest. This was the median sacral crest. This is the medial sacral crest formed by fusion of the articular processes of adjacent vertebrae. Then lateral to these articular tubercles, these elevations are called as articular tubercles. Lateral to these is presence of these dorsal sacral foramina, right? And then lateral to these, because of fusion of the transverse processes, the true transverse processes, there is formation of this lateral sacral crest which ends inferiorly at the inferolateral angle, right? Okay, another thing is that the inferior articular processes of the S5 vertebra, they are free and they form the cornu of the sacral hiatus. At the inferolateral angles of the sacral hiatus, these cornu are actually representing the inferior articular processes of the fifth sacral vertebra, right? And these are the articular processes of the coccygeal vertebrae. Sometimes these may be united with the cornu of the sacral hiatus, and then a fifth dorsal sacral foramina would have been created, right? Okay, so this is the lateral sacral crest. Now another surface of sacrum which I have not talked about is the lateral surface of the sacrum. Here you can see that the sacrum has a lateral surface also that lies between the pelvic surface and between the dorsal surface. This lateral sacral surface consists of, you can see this L-shaped articular surface. Now if you remember the hip bones, on either side of sacrum, it articulates with the right and the left hip bones to completely form the bony pelvis. Bony pelvis consists of the two hip bones articulating together at the level of pubic symphysis, and posteriorly each hip bone articulates with sacrum at the level of sacroiliac joints. Where is that sacroiliac joint formed? That is formed between this L-shaped auricular surface of the sacrum and a correspondingly L-shaped, or we also call it as ear-shaped auricular surface that you will remember is present on the ilium. Now that auricular surface of ilium, behind it had a rough pitted area that was called as the iliac tuberosity. Similarly, we have this sacral tuberosity, which is the rough pitted area behind the auricular surface. This surface of sacrum as well as of ilium, they give attachment to the interosseous sacroiliac ligament, which is one of the stabilizing ligaments of the sacroiliac joint, whereas this auricular surface participates in the formation of this synovial joint between the sacrum and the ilium. Right. So, what is the significance of these sacroiliac joints are? Via these sacroiliac joints, weight is being transmitted, weight of the trunk as well as the upper limbs and the head and neck, which are attached to the trunk. The weight of the trunk and the upper part of the rest of the upper part of the body is transmitted via the upper part of sacrum and then via the sacroiliac joints to the hip bones and subsequently to the femora. That is why upper part of sacrum is participating in transmission of weight of the trunk, whereas lower part does not participate in any weight transmission. That is why upper part is wide and bulky, which participates in weight transmission, whereas lower part, it rapidly tapers down and it is small and thin. You can compare the thickness also of the upper part. Right. Now this auricular surface, it is present roughly in the upper three bodies of the sacral vertebrae, S1, S2, S3. It is limited to up to the S3. Okay. Then there is this narrow area also below the auricular surface and the sacral tuberosity. We look on both the sides. This is the auricular surface. This narrow triangular area, this also forms part of the auricular surface, and this gives attachment to three structures. From behind forwards, they are the gluteus maximus muscle that takes origin from, in addition to several other places, it takes origin from the posterior part of lower part of lateral surface of sacrum. Then the sacrotuberous and the sacrospinous ligaments, they are attached here, and then what is attached here on in the anterior most part of this thing is the coccygeus muscle. So we have the gluteus maximus, the sacrotuberous and the sacrospinous ligaments, and the coccygeus muscle, they are attached to this narrow triangular area which forms the lower part of lateral surface, right? And then this is the inferolateral angle of the sacrum, right? Then one thing is, now what is this part here? You can see this part. This is the, again, the vertebral canal. Now this is called as the sacral canal in the region of the sacrum, and in the anatomical position, even though the sacrum is directed backwards and the upper surface of body of S1 vertebra, that forms an angle of 30 degree with the horizontal, right? Roughly 30 degrees of angle is formed with the horizontal, but the sacral canal, that faces almost vertically upwards. Now what is passing through the sacral canal? Those are the roots, only the roots of the S1, S2, S3, S4, S5 and the coccygeal spinal nerves, which are going to emerge. The dorsal rami are going to emerge through the dorsal sacral foramina. First, the dorsal rami of first sacral spinal nerves through these first pair of dorsal sacral foramina, second through these, third through these, fourth through these, whereas the fifth sacral spinal nerve entirely, along with its both the dorsal and ventral rami and the only pair of coccygeal nerves, they emerge through the sacral hiatus. So the this sacral canal contains the lower part of chorda equina. It contains the dura mater and the arachnoid mater also, which end at the level of S2, roughly at the level of spine of S2. So the subarachnoid space and the subdural spaces, they also end at the level of S2, and then what remains is the lower roots of these S2, S3, S4, S5 and the coccygeal nerves, and there is something called as phylum terminale, which comes out through the sacral hiatus and attaches to the coccyx, right? And then through what comes out through the pelvic sacral foramina, they are the ventral rami of the this S1 pair of spinal nerves, S2, S3, S4, Remember that S5 spinal nerve, it emerges out through the sacral hiatus, then it grooves the lateral part of the fifth sacral vertebra, and the ventral ramus will emerge forwards and laterally, whereas the dorsal ramus will supply the dorsal body wall. Right. Another thing that enters through these foramina are the lateral sacral arteries, whereas the median sacral artery, that is related to the median part. Right. Then what are the attachments on the sacrum? Now, on the rough part of the ala, here is attachment of the iliacus muscle. Most of iliacus takes origin from the iliac fossa of the ilium, whereas, however, in addition, it takes origin from the lateral rough part of the ala also. And to the ventral part, there is attachment of the ventral sacroiliac ligament as well, right? Then to the middle three pieces. This was S1, S2, S3, S4. To the area of these middle three sacral vertebrae, the area lateral to their bodies, that is these bars of bones, and this area as well. This E-shaped area gives origin to a muscle which was the key muscle of the gluteal region. Remember, that was the piriformis muscle. So that takes origin in the shape of an E from these bars of bones lateral to bodies of S2, S3 and S4. From here, from here, from here, and this area, this lateral mass, and this muscle will go laterally and then emerge through the greater sciatic foramen, which lies just here, and it will emerge in the gluteal region. Right. Okay. What else is emerging through these foramina? The ventral rami of S1, S2, S3. Right. These are going to, along with the ventral rami of L4 and L5, they unite to form something called as the lumbosacral trunk, and that unites with most of the ventral rami of S1, S2, and S3 to form the sciatic nerve. Now remember, sciatic nerve emerges through the greater sciatic foramen below the piriformis muscle. So here in this region, your sciatic nerve is being formed by lumbosacral trunk, which is nothing but the fused ventral rami of L4 and L5. Then S1, S2 and S3 unite with lumbosacral trunk to form the sciatic nerve, which emerges through the greater sciatic foramen below the piriformis. Right. Okay, piriformis is attached here. Then on the lateral aspect, we have already done gluteus maximus and coccygeus muscles are attached, and in between sacrotuberous and sacrospinous ligaments are attached. On this rough pitted area behind the auricular surface, there is attachment of the interosseous sacroiliac ligament. Then on the posterior surface, there is a U-shaped attachment to the median sacral crest and to the lateral sacral crest, which are formed by the spinous processes of the sacral vertebrae and the fused transverse processes of the sacral vertebrae. This U-shaped attachment is of one of the longest muscles of back, that is called as erector spinae, and the area between the median and the lateral sacral crest, which consists of the dorsal surface of the laminae and these costal elements which are fused with each other. Not costal elements are present anteriorly. So the laminae and the posterior surface of transverse processes, this area in between, this entire area gives origin to another muscle of back, that is called as the multifidus muscle. Right. So posteriorly there is attachment of erector spinae and to the multifidus. Okay, sorry for that interruption. Right. Then where were we? We have done the lateral surface, the dorsal surface. Yeah. Now coming to the relations of the sacrum. One of the very commonly asked questions in Viva is which structures are related to this part of the ala. Now there is a mnemonic from medial to lateral. The structures are SLIO, SLIO. Out of those, the medial most structure is something called as the sympathetic chain. You will read about the sympathetic chain and sympathetic trunk in the autonomic system. The lowermost parts are lying related to the medial part of this ala, and they continue downwards medial to the pelvic sacral foramina, and somewhere here there will be formation of something called as ganglion impar. Then from medial to lateral, slio, SLIO. Now the L I have already told you, that is the lumbosacral trunk, which is formed by fusion of L4 and L5 ventral ramus. So that is going down, and it will fuse with S1, S2 and S3 ventral rami to form the sciatic nerve, which will lie below the piriformis muscle, emerge out from greater sciatic foramen below the piriformis muscle. Then there is I and then there is O. The I is an artery called as the iliolumbar artery, which is one of the branches of posterior division of internal iliac artery. And then O is the obturator nerve that runs medial to the psoas major muscle. These you will be studying subsequently in the pelvic cavity and in the lecture on the lumbar plexus. So, SLIO, sympathetic chain, lumbosacral trunk, iliolumbar artery, and the obturator nerve. They are related to this part of the ala of the sacrum. Then the upper 2.5 parts, they are covered by peritoneum, and behind the peritoneum they are related to the median sacral artery, whereas the lower 2.5 pieces are directly related to the rectum, lower part of the rectum, right? And then obviously this part will be related to the ventral rami and formation of sciatic nerve, and posteriorly we have that the dorsal rami of the sacral spinal nerves. The fifth sacral spinal nerve pair and the coccygeal comes out. Phylum terminal comes and attaches to the coccyx. Right? So now another thing is the differences between the male and the female sacrum. Now, one, I have already told you that females have a broader sacrum. In males, the width of the body is greater than the width of each ala, whereas in females, the width of the body is equal to the width of the ala. So, males have a narrower sacrum, and if we compare it to the length, males have a longer sacrum. So, compared to the breadth, the length of the sacrum, if we compare it between males and females, there is actually an index called as the sacral index, which is the width of the sacrum at the base divided by the length of sacrum from this point to the apex. Now, this point I have forgotten to tell you, this point is called as the sacral promontory, and the sacral promontory, it projects forwards and downwards at the uppermost part of posterior wall of the pelvic cavity. This is called as the sacral promontory. So from sacral promontory up to the apex of the sacrum, we take the length, and here we take the breadth. Here you can very clearly see the breadth is comparatively, it seems to be less. It is actually equal to or slightly greater than the length of sacrum. Here you have to, subtract out the coccyx here. So this length is almost same as this width. So this is a male sacrum. What are the other features of the male sacrum? The this pelvic surface, it is smooth, it is smoother as compared to in females, and it is, however, the concavity is less, it is comparatively shallower. If this was a female sacrum, then the ridges between S1 and S2, and especially between S3 and S4, they are highly prominent. So the pelvic surface is less smooth in case of a female as compared to a male. And secondly, the concavity of this pelvic surface is greater or deeper in case of females, right? And then we have already done the width is greater in females. The females have a broader and a shorter and a deeper sacrum. So sacral index is width divided by length multiplied it by 100. That comes out to be about 105% in case of males, but 115% in case of females. So even in males, the breadth is larger than the length, but in females, the breadth is much larger as compared to the length of the sacrum. Right? So That is all. Ossification you can read from their books. The ossification is quite resembles the ossification of the lumbar vertebrae. Each body has three primary centers, and there are secondary centers also. There are a few more additional secondary centers that is rarely asked in exams. What you should be able to know is how to place it in the anatomical position. In the anatomical position, you do not place it vertically, but you place it with the superior surface at 30-degree angle, so that the pelvic surface faces forwards and downwards and the dorsal surface faces backwards and upwards. Then you should be able to identify these S1, 2, 3, 4, 5, the pelvic sacral foramina, what passes through them, dorsal sacral foramina, what passes through them, which is the median sacral crest, then the medial sacral crest, how is it formed by the articular tubercles, and then the lateral sacral crest, how is it formed by the transverse processes, and anterior part of lateral mass is formed by fusion of the costal processes. What is the sacroiliac joint? How is it formed? What are its ligaments? Which part takes part in weight transmission? What are the muscles attached? What are the relations? Right. Then there is something called as sacralization of the lumbar vertebra. Here, if I take a fifth lumbar vertebra, and if even the fifth lumbar vertebra gets fused with the first sacral vertebra, that is called as sacralization of the lumbar vertebra. And the reverse can also happen if the first sacral vertebra is not fused with the rest of the sacral vertebrae. That is called as lumbarization of the first sacral vertebra. Right. So in sacralization of the fifth lumbar vertebra, what can happen is the fifth spinal lumbar nerve, fifth lumbar nerve, that might be compressed where it emerges from the intervertebral foramina between the fifth, the superior articular process of the first sacral and the inferior articular process of the fifth lumbar vertebra. This intervertebral foramina might be narrowed and the L5 nerve might be compressed. That might lead to sciatica. Another reason that I forgot to tell you in the lumbar vertebrae is another thing what can happen in case of lumbar vertebrae is this. If I articulate these two lumbar vertebrae and show you here, now there is something called as the intervertebral disc prolapse. Now we know that between the two bodies of the two lumbar vertebrae, that gap is filled with the intervertebral disc. Now you look at the posterolateral part of that. So this hole is covered by the intervertebral disc. The posterolateral part of that intervertebral disc is forming the one of the anterior margins of the intervertebral foramina. If I again articulate these two together, you can see that the posterolateral part of the intervertebral disc will form one of the anterior margins of this intervertebral foramen. So what happens is that the intervertebral disc is formed of a peripheral region called as annulus fibrosus, which is made up chiefly of the collagen fibrils and fibrocartilage, and the central part is gel-like called as nucleus pulposus, which is the remnant of the fetal notochord. Now, in young people, the annulus fibrosus is very strong, and when you are standing erect and your the weight of your trunk is being supported by the lowest part of the lumbar vertebral column L5. Now that nucleus pulposus is being compressed, it tends to try to push out through the annulus fibrosus, but in young people, the annulus fibrosus is very strong, so the nucleus pulposus is retained within. As we age, this annulus fibrosus starts weakening. It starts losing its water content, it starts undergoing desiccation, and sometimes the nucleus pulposus can bulge out through breaks in the annulus fibrosus. The most common area of bulging out is the posterolateral part. Right. So if nucleus pulposus bulges out through the posterolateral part of intervertebral disc, it is going to compress the spinal nerve emerging out through the intervertebral foramina. It is going to press on that spinal nerve, and that is going to produce sensory as well as motor symptoms. So this is called as prolapse of intervertebral disc. That is most common in the lower part of the lumbar spine between L3, L4 and L4, L5 vertebrae, the intervertebral discs between L3, L4, and L4, L5, and it is also common in the lower cervical region. So, in the lumbar region, it might lead to compression of the emerging spinal nerves. Another thing that might compress is the osteoarthritis of these intervertebral joints, whether it is between the superior articular process of the lower vertebra and inferior articular process of the upper vertebra. There is formation of reactive bone formation. Those are called as osteophytes. They may protrude forwards and they may also compress the spinal nerve from behind, and again leading to sensory as well as motor symptoms. Another thing that is called as spondylolisthesis. Spondylolisthesis, what happens in spondylolisthesis is that the fifth lumbar vertebra, if it is lying over the fifth lumbar vertebra, it slips forwards above the body of the first sacral vertebra. That also is going to compress the fifth lumbar spinal nerve. Right. Okay. Then another thing is about the curvatures, primary and secondary curvatures, and how are they formed. That I will be showing you in a structure of the 3D model of the spine in the next video.